Welcome to this month's episode of Parenting Unplugged. Today we're discussing adolescent substance use. Joining us is Beth Menges, a licensed clinical professional counselor and certified alcohol and drug counselor. With 30 years of experience in the field of addictions, she manages addiction services at Endeavor Health Behavioral Health. Beth will provide us insights into the stages of substance use, current trends, and effective parental strategies to keep teens safe. Beth, can we start by discussing the stages of substance use? What do parents need to know about how substance use develops in adolescence?
Thanks so much for having me today. I'm really excited to be able to talk about the topic of substance use and what we kind of need to be aware of as parents and what would be helpful strategies for helping keep our teens safe and away from substance use. So starting off, if we look at the stages of substance use usually develops over a period of time. The first stage of substance use is usually experimentation. And what this looks like is students or teens using occasionally. Maybe they try something one or two times and they don't like how it makes them feel and they don't go back to it again. The next stage we would look at is more regular use or social use. And this might have more of a pattern. Maybe it's on a Friday night with their friends, they're having a few drinks, maybe they're using marijuana a couple times a month. Again, there's really no consequences that we're seeing because of that. What's really important, though, is to be having conversations with your teens early, because the next stage is looking at the abuse. And when you get into abuse, that's when you're starting to see more consequences related to their substance use. You might see them give up friend groups. Maybe they start to fail in school. Maybe they give up certain social obligations. And that's when there's more concerning behaviors in that last stage of abuse. Again, speaking to kids at an early age in regards to substance use is really important, especially if there's any type of family history related to substance use. One example I often like to share, and my kids sometimes I think are not happy when I share examples from their lives, but we had a grandparent on both sides of the family that struggled with smoking, and they both passed away from lung cancer. And so when my son was very young, at the age of 6, we started to have a conversation about nicotine use and smoking and the dangers of that, and that is explaining that is how his grandparents passed away. And one time we were walking in the Target parking lot and we saw some person smoking, and my son blurted out, "He's going to die." So I'm not sure if the education worked or not, and I learned that I needed to cut back a little bit on some of what I told my kid.
What are the warning signs that a teen might be experimenting with or using substances regularly?
Some of the warning signs that parents can look for to understand if their teenager is experimenting or abusing substances would include mood changes or irritability, poor hygiene or change in appearance. Maybe they're starting to isolate, they're starting to change their friend groups. You'll start to notice some issues in school. Maybe you see a change in their grades. Maybe their attendance is dropping. And then sometimes you might notice glazed or bloodshot eyes. That would be a physical sign that you might see. What's really difficult, I think, when looking for substance use in kids is sometimes a lot of these things that I just mentioned are also just signs of being an adolescent. What adolescent doesn't want to just go hide in their room and isolate away from family? What adolescent doesn't have mood changes or irritability? Maybe they're changing their friends groups. So sometimes it can be really difficult as a parent to try to differentiate if we're really looking at substance use or just looking at normal adolescent behavior. And so again, really being engaged with your child will be really important to help you be able to differentiate what might be happening in regards to the signs that you're seeing.
How does substance use evolve into more problematic behaviors, and what are some red flags?
Some of the red flags that you're wanting to look for is when the substance use becomes more of a focus. Maybe, again, over schoolwork. Maybe they've done well in school before. Maybe they've participated in sports or other extracurricular activities, but you'll see them declining, not participating as much, avoiding those things. That would be one area that you wanted to look into. Maybe you'll start to see some problems in relationships. Maybe your own relationship as a parent with them. Maybe you're struggling in that relationship. Maybe other friendships that they've developed or other partners that they're involved with. Maybe all of a sudden, you don't see them really hanging out with them anymore because that other person doesn't want to be involved in that type of behavior. They start to neglect responsibility at home. Again, schoolwork. School is going to be a big area really to focus if you start to see a decline in that, to look at the possible substance use going on at that point in time. And then the biggest one is that change in behavior. Usually isolating, maybe irritability, a little bit more aggressive type of behavior, verbal escalation. Those would be types of things you would want to look at as red flags.
What trends are we seeing in adolescent substance use locally and nationally? And are there any surprising patterns or new developments?
The trends that we're seeing in adolescent substance abuse locally are very similar to what we're seeing nationally. We're showing that most teens are reporting use of alcohol, nicotine vapes, and marijuana. Those are the most commonly abused substances by adolescents. This also holds true for what we do see currently at Linden Oaks, for patients that are coming into Linden Oaks, but just in general within the DuPage, Will County communities. Some of the other substances that are also being abused by adolescents are Xanax, which is a benzodiazepine, Benadryl, and cough medicines. Actually, when I was speaking to some of the adolescents that are currently in our program, they wanted to make sure that I brought that up in the discussion today, how much they are using and abusing cough medicines such as Robitussin, Dialsum, and anything that has dextromethorphan in it. And dextromethorphan is usually when you're going to see the DM on the product, and those are things that can be abused by teens. Really by anybody. I've had a cold recently and went to the store and had to get some NyQuil with DM, and I had to show my driver's license to be able to purchase the NyQuil. So it just goes to show how easily some of that can be abused by these kids. One trend that is surprising to me is seeing the decrease in alcohol and marijuana use that's been reported in 10th and 12th graders for the last few years. And I think why this is surprising to me is because with the work that I do in addictions, I see the teens and young adults coming in that are abusing substances. So sometimes I can start to think like everyone must be doing this. But according to the Monitoring the Future survey that is done in many high schools, they are showing a decrease in alcohol and marijuana use in 10th and 12th graders, which is great news. We want to see our kids using less and participating more in school and extracurricular activities. Use of tobacco products have also decreased for high schools, but interesting, they've increased for middle school students. So again, this is a surprising trend that we're seeing, that at an earlier age, kids are starting to use nicotine products, such as nicotine vapes. There's also a newer product. Actually, I don't think it's that new, but it's kind of a newer trend. They're called nicotine pouches. One of them is called Zyn, and it's very common on TikTok because the people that kind of promote that are called Zinfluencers. So the kids are really into some of those slangs and understanding what that means. And again, when I was talking to some of the kids we have in our program, they were actually sharing how they've bought drugs from middle schoolers or gotten vapes from middle schoolers before. So definitely we know that this is getting more and more common. E-cigarettes are the most popular product that have been used now by high schoolers for the 10th year in a row. And 9 out of 10 of these are flavored e-cigarettes. So again, the marketing when this first happened was for adults to be able to use this to help them stop smoking regular cigarettes. But really, it's turned into a way that our kids can now start smoking. And most of the time, the research shows they are not using regular nicotine cigarettes anymore. The vast percentage that are using nicotine are vaping it in a flavored form.
You talked a little bit about marijuana. Since the legalization in Illinois, have you seen anything change?
Some of the changes that we've seen since marijuana has been legalized has to do with the perceived risk of it. A lot of adolescents really don't perceive there's much harm in using marijuana. And what we're also seeing is a lot of parents that actually use marijuana. A lot of times they're using edibles. Sometimes they're using what the terminology is now is flower, which was just in the good old days for me would have just been your regular joint or weed, but they call it the flower. So we definitely see parents using a lot more and feeling also that that's not that big of a deal. And so not minding if their kids are doing it or, not really taking it seriously if their kids are using marijuana. I think what a lot of parents don't know, and a lot of people in general don't know, because again, we see this in our young adults and into adulthood, is what has changed with marijuana over the years. And so over the years, the potency of THC has gotten stronger and stronger. I believe back in the 80s, we were at about 4% THC. And today's average is about 15%. But when you're talking about some of the edibles, when you're talking about some of the cartridges, which with THC oil, they can have as much as 70 to 90% THC. And what happens when people use those type of products on a regular basis, and I've seen it for myself in the hospital setting, patients will come in with psychosis. They will come in with extreme paranoia. And for some people, this will turn around and they will get better and they will come out of it. And for some people, they do not. So with the legalization of marijuana, we've really forgot to talk about the long-term effects, especially when someone starts to use in adolescence. And again, some of the effects I've seen in young adults and adults in regards to psychosis and paranoia that happens. But some of what we know in regards to adolescent marijuana use is if you're using at a younger age, you're more vulnerable to marijuana and other drug addiction later in life. And this doesn't mean automatically because you use marijuana that you're going to move on to other substances, but there is a greater propensity to possibly do that. There's also lower academic achievement and higher risk of dropping out of school. People who begin to use marijuana before the age of 18 are 4 to 7 times more likely to develop a cannabis use disorder than other adults. A cannabis hyperemesis is another kind of phenomenon that we've seen more recently over the last couple of years. And this is when there's recurring episodes of nausea and vomiting. In our emergency departments, we often see this. The doctors there are very aware of what this type of syndrome is now. When adolescents and adults are coming in and have unexplained vomiting, a lot of times it's very much related to their cannabis use. And how this happens is actually when they stop using, they start to vomit. And almost in order to feel better again, they have to continue to use. And so this cycle can be very difficult to break out of.
What role has the pandemic played in these shifts?
It was interesting to see some of the research after the pandemic in regards to substance use. What some of the initial research showed was a decline in marijuana and alcohol use amongst 10th and 12th graders. And a lot of the thought at the time was that we would continue to see a rise in that after kids got back into school. The thinking was that because they weren't in school during the pandemic, that really limited their access to substances, since again, school is often a place where kids are able to get their hands on these substances. But we've continued to see since 2020 and through 2023, it's continued to hold pretty steady that the levels are lower in regards to alcohol and marijuana, which we did speak about a little bit earlier. And it'll be interesting to see if those levels continue to remain the same.
Let's move on to prevention and intervention. What strategies can parents use to keep their teens safe and healthy?
One of the most important strategies that parents can use to keep their teens safe and healthy is really being aware and being engaged. I think a lot of times parents think they'll know if there's a problem with their adolescent, and they're really not aware of how easily adolescents can hide their substance use or any other mental health issues from their parents. So I think being involved and engaged and communicating is one of the most important strategies to be able to do that. Again, early conversations, as I shared earlier, kind of with my own children, and really started with nicotine, which people see nicotine all the time, or with alcohol that's very readily available. Having conversations with them to understand the dangers that those substances can have, especially if you've had a family history. And I think that's really important to be aware of. If there's a family history, sometimes people are embarrassed to talk about that family history. But if your kids aren't aware of that and what those consequences have been, they may think that it's not that big of a deal if they start to pick up substances. One adolescent that I spoke to recently did share that he wished that his parents had talked to him a little bit more instead of just saying, just say no or don't do drugs, they're bad for you. Wish that they had some more examples of that or shared a little bit more about their own personal stories. And sometimes parents don't want to share that, again, because they might feel embarrassed or they think their child's going to look down on them. But it would be important for them to have that information. Another area is looking at what we call the 4 C's, and that's having clear rules, consistency, checking up, and keeping up your communication with your child. So first of all, having those clear rules is really important. You want to set clear expectations, and you want to follow through on what those consequences might be. And that leads to that consistency. And check up on them. If they say they're going to be somewhere or do something, it's okay to check up and make sure they're where they say they're going to be. I think parents nowadays have a lot of resources available to them. Sometimes you want to really trust your kid and not have to use those resources. But I think it might be important to have Life 360 on your phone and know where your kid's at. For my kids, again, who are through adolescence at this point in time, but they knew sometimes they might have a drug screen. I actually sometimes kept them out on the kitchen counter so that they saw them. Parents a lot of times are very surprised, like, I don't know where to get drug screens at. You can go to your local Walgreens, you could just order them on Amazon anonymously and order them. And so if you have suspicions that your child might be using, you can always do a drug screen and find out for sure and gather some information from that. The other areas you want to look at is not really being a friend. You want to be a parent. You want to set appropriate boundaries with them. You want to support any healthy activities that they're involved with and really engage with those activities with them. You want to be a model for healthy behavior. So again, your own substance use, your own alcohol use, they often are looking to you. And so they want to model that behavior you're showing. So having healthy behaviors is important.
How can parents set boundaries without enabling behavior?
Setting boundaries and enabling are actually two different things. And so, setting boundaries, as I talked about earlier, is important by setting clear expectations and then following through on those consequences. And a lot of times, if you're going to set smaller consequences, that's going to be better. Sometimes parents almost punish themselves by giving their child a consequence like, oh, you're going to be grounded for the whole week. And after a day, you're thinking, I can't follow through with this. So maybe you start with grounding for a day or taking away the phone for a few hours or a video game for a period of time and not make it be some huge extension of that. So clear expectations, following through on those expectations, and remembering that smaller consequences are better. Enabling behaviors look more like when you almost help your child get out of something. And so if you're making excuses for them, if maybe they've gotten a bad grade on a test, and making excuses and not really helping them to be able to perform better, that would be more of an example of how you might enable a behavior. And so not getting caught up in that will be really important and helping following through with those boundaries and consequences that you have set up.
What role does supervision and monitoring social media play in preventing substance use?
Keeping an eye on social media is a big role that you parents play in their kids' lives. And it's almost like an oxymoron that you need to keep an eye on social media, but you also want to respect their personal boundaries. And as an adolescent, anytime you're kind of digging around or looking at what they're doing, they really find that as disrespecting their personal boundaries. But as a parent, again, you have to have some rules and expectations. And so being able to do that through some of the apps that are available, as mentioned before, like Light 360 is really, really important. Being aware of what they're watching on social media, who they're talking to and who they're interacting with on social media. It'll be important to educate yourself about, again, what's new on social media. What are new apps they're using? What are new slangs they might be using for different terminology that's just so different for us as parents and adults? Maybe they're using different emojis that explain substance use. I believe attached to this presentation will be a sheet with different emojis that mean different substance use. And so if you're seeing that in your child's text, that also could be kind of a red flag in regards to substance use. You may hear them or see them type out slangs for drug use. If they call something a J, that's a joint. That means they're using a joint. Nic is their way that they talk about nicotine. Carts, if they're talking about carts, that's usually referring to a marijuana cart. Muha, M-U-H-A, is a really strong form of THC, and it's very small and it's really easy to hide. So kids can easily bring that into school or bring that anywhere and not get caught with it. It's actually a problem that we have even in treatment is we can't search the kids that come in. And so they know where they can hide these items that are very, very small and they can get away with it. They can go into the bathroom again at school and be able to use one of these marijuana carts or nicotine vapes. Geek Bar is another brand that people are using. It's a vape brand that they have. So being aware of this would be really, really important. And again, sometimes it's as simple as Googling, what are common slangs that kids are using for substances these days? And you'll be surprised what you can find out just by Googling some of that information.
Many teens struggling with substance use also face mental health challenges. Can you explain the concept of dual diagnosis and its implications for treatment?
Dual diagnosis or co-occurring disorders are when a person has a mental illness alongside a substance use disorder. Often, as parents especially, but even as treatment providers sometimes, we're looking at what came first, the chicken or the egg. It's not always easy to identify, was the mental health issue of anxiety or depression there first, and then the substance use started, or was the substance use primary, and then that led to some of the depression and anxiety that someone may be experiencing. And since it's difficult to be able to tell what came first, we often want to treat both of those disorders together. And that's what we call dual diagnosis or co-occurring disorders, treating both a mental health disorder, most likely anxiety and depression are the most common, along with a substance use disorder. Over 50% of young adults ages 18 to 25 with a substance use disorder also have at least one co-occurring disorder. So again, we're talking about a pretty good percentage of people that experience co-occurring disorders.
What signs might indicate a co-occurring mental health disorder?
Oftentimes, when someone is struggling with depression or anxiety, they're going to use substances to help self medicate. And that, again, is where this co occurring or dual diagnosis comes from. And some of the signs to look for are isolation. Maybe it's social anxiety or school anxiety, refusing to go to school. Sometimes, especially adolescents, feel like they need to be high or under the influence and able to get through the day at school. So we see that often as a way that they're self medicating. We also see that with marijuana, and a lot of times people feel like the marijuana is helping with their anxiety. And oftentimes, when they stop using, that anxiety actually lessens. And teens and adults both are actually very surprised to find out how much more their anxiety is under control when they stop abusing marijuana or other substances.
How can parents advocate for comprehensive care for their child?
First and foremost, by being honest with care providers. Again, I think when we look at mental health and substance use disorders, there's a lot of stigma that go along with those disorders. And oftentimes, parents or really anyone do not want to be honest with their regular care providers, your primary care physician, your pediatrician. It would be really important to let them know what signs and symptoms you're seeing in your child so that they can help with the appropriate referrals to possibly get them someone that specializes with mental health or substance use disorders. There's lots of different treatment options when someone has a mental health and substance use disorder. The least intensive is what we call individual therapy. And so someone would see an individual therapist just one on one, maybe once a week or once every couple of weeks. That also may include medication management with an advanced practice professional or a psychiatrist to start medication for depression or anxiety. And we also have medications that can help with some substances too to help alleviate cravings. Some of the more intensive therapies, similar to what we offer at Linden Oaks, might include your IOP, and those acronyms stand for Partial Hospital Program or Intensive Outpatient Programs. And those programs are 3 to 6 hours a day, like Monday through Friday, 5 days a week. It's almost like going to school. Kids are in group with other kids that are experiencing similar situation. They're learning skills to help them stay sober and remain abstinent from substances.
It's clear that understanding these issues can help families navigate substance use challenges more effectively. Thank you for sharing your expertise on this topic.
Thank you for having me. I appreciate any opportunity to be able to discuss adolescent substance use and prevention strategies for parents.
For our listeners, you can find additional resources at ehealth.org/LOH-Parenting Unplugged. Stay tuned for next month's episode, where we'll continue exploring strategies for raising healthy, resilient teens.